So I would also go back to the pharma comment. Yes, does pharma drive innovation? Absolutely. The problem is that J&J does not share data with Pfizer, does not share data with Merck. Until we have open data, open access, which we may never have, innovation will remain at a very slow rate in those areas because Pfizer may have a piece that Merck doesn't have and they have this piece. If we had open access, and there's a hashtag on Twitter called Open Access. We started it at the American College of Cardiology and we're trying to promote that type of data sharing. The Duke Clinical Research Institute basically opened its data banks and said, we're not going to charge you. Anybody who wants to use our data to innovate, use our data. And I think that's critical because right now, and I'm not bemoaning that, pharma's about pharma. They want to put money in their shareholders' pockets because they have to go answer to the street every single day.
Thank you, comrade, for that wonderful insight into sharing data. It's not going to pay my mortgage.
Well, that's the problem, and I think it's a big issue with pharma siloing data so that innovation is lagging behind when we could be much further ahead if we were having open access.
I think that certainly economics and IP are big problems, but just as you would argue the democratization of data and the transference of data from one silo to the other silo is important, the economics of innovation is just as powerful. The ability to make money and to develop drugs. So it's the incentive. So I think it's a tricky idea, but
here's the flip side. I have a child with type 1 diabetes. Insulin has gone through the roof. Why has it gone through the roof? Because the three main makers of insulin who force you to use analogs have sued the companies that are making biosimilars to make them stop so that they can't make a cheaper version of insulin. I have insurance. There's kids out there and adults out there who don't take the necessary insulin that they need because they can't afford it.
Is that discussion, Kevin, part of the innovation discussion? Or is it part of the litigious environment?
No, I think it's part of blocking innovation through greed.
And it's also about responsibility, right? When we look at some of the large tech legacy systems, Epic, Cerner, Allscripts, NextGen, ECW, they have all the data, right? They have all the data. And to your point, if even one of them starts to disrupt in this space and to look outside of the EMR space in a truly disruptive way, I've been following Allscripts for some time, and they made an acquisition of a company called HealthGrid. They do our patient engagement. And it is fascinating that they have actually, from an EMR standpoint, accepted the fact that people are not going to their portal. You're not going to the portal. So how do we get another company in here that's going to text patients, hey, you turned 40, happy birthday, here's your mammogram, right? You're not going to the portal, no problem. Hey, here's a text, here's your lab results, here's your discharge summary. I think that we have to look at companies like an Allscript, and we need to turn to a company like Cerner and Epic and say, what have you done for the industry lately, right? Very similar to pharma. They have an opportunity to make more money. Please make more money. Please innovate so that you make more money.
Well, maybe Apple Health Records will help solve that as well, because one of the words we haven't mentioned yet in these disruptive companies is design. And design is very, very important. It's the secret in the sauce of Amazon. It's the patient engagement, the customer experience. It's why people like Wegmans grocery stores and Chick-fil-A, because they get customer experience right. And Apple Health Records has that opportunity. So maybe people will engage more if it's a sexy, fun portal that's relevant to me.
And maybe that is the domain of Amazon. I mean, to me, Amazon doesn't want to be pharma, and quite frankly, pharma doesn't want to be Amazon either, yet they fight over the same turf in this abstract notion defined by patient centricity, which makes me crazy. Let Apple be patient-centric. Let pharma be the bastion of brilliance where innovation can percolate. So again, we mush them together, and it's funny.
And I think to your point, Jane, about design, it's about keeping it simple, right? Healthcare, I know we all think it's special, it's really sensitive information. Look at the banking industry. Look at the airline industry. Look at the hospitality industry. You don't have to stand in long queues at the airlines anymore. You check in before you go. When's the last time you actually physically went into the bank?
You're spot on. The Apple Store, the inspiration for the Apple Store came from hotels.
Exactly.
It came from the concierge model. People,
Exactly.
Steve Jobs recognized that the concierge is the greatest thing, so they invented the Genius Bar. Why can't we have a Genius Bar in our doctor's
Well,
office?
and the thing about Apple, it's a great example because any Apple product, right? When you open it, how do you get trained on it? Do you have to do training, right? There's no patient portal training. You don't need to get trained on how to open a text message so that you can then get your clinical data. I mean, I think the industry, we have to keep it simple.